Thanks, Dr. Zelmer. My name is Osmani Cruz. I am a resident of the Galesville area. I was asked to share my experience with the vaccine process and kind of my decision-making in regards to wanting to decide to get the vaccine. I was vaccinated some months ago already, and I just wanted to share a little bit about, I guess, why I decided to do it and how it affected me. There were basically two main reasons for why I decided to get the vaccine. I work at in a profession in which I am more susceptible to contracting the COVID-19 virus. I had a lot of scares with certain contacts that I had with people where I went home and I thought, oh boy, I wonder if I had it or if I got it from that person. So after several scares, I just decided, you know what, I'm kind of tired of having to deal with those scares and having to relive that over and over again. Also, my mother is she's a little bit older, and she's had a history of health problems, and it's been probably a year since I had seen her, and the pandemic was one of the reasons why we could not see each other. And I kept thinking, if I bring my mother here, she lives out of state, and I were to get her sick, I would feel terrible about myself. That was not something that I want to expose her to. So those are basically my two main reasons for deciding to get vaccinated. As far as the vaccination process itself, it was very smooth. I believe I coordinated it with the health department and got me in very reasonably soon. The process was very, very smooth once I got to the facility at which I got it done. I thought the staff did a great job of informing me of the potential risks or kind of things that I could expect after getting the vaccine. There was like a 15-minute waiting period after being vaccinated. I felt no effects personally within that period. I actually went to work that same day. I did start to feel some minor effects later in the day. It increased quite a bit before I went to bed. Basically some muscle aches, headache, quite a bit of chills, but then after I woke up in the morning, they had all subsided. I think everything just about for a mild headache, and I was feeling pretty much normal by the next day. That happened on the first shot that I got. I did take the Moderna vaccine, and then on the second, I also felt the exact same symptoms. Again, didn't really affect me too much. Right before I went to bed, I started to feel a lot more of the chills. When I woke up the next day, other than a mild headache, I felt pretty darn good, and I went about my day as normal. Obviously, I had concerns about the side effects and the effectiveness of the vaccine, as I know a lot of people do and still do, and that's why I think that it's great for people to educate themselves and using good sources as the source of that information. Be wary of social media and some of the stuff that you see on there. I know I had to kind of stop looking at social media for some of that information because I felt that it was very unreliable. So asking your doctor, going online to the CDC website, and talking to professionals who actually know what they're talking about, and making that individual decision on whether or not you want to take it. I had two main reasons for deciding to get vaccinated, and I'm very satisfied with the outcome and that I have not gotten sick. And I encourage you all to do your research and make that decision for yourselves. So thank you.
Thank you. My name is Lindsay Schubert, and I live here in Galesville, and I work for the GET School District. I am the Director of Special Education and Pupil Services for the district, and so similar to Manny, I had multiple reasons why I decided to get vaccinated. I was one of the lucky people that did not contract COVID. During this year that we've been in school and kind of been dealing with the pandemic, but I do, in a district level position, interact with all 1,400 students in the district on a regular basis and really was wanting to make sure that not only was I protecting myself, but I was protecting all of them. We have obviously students in the district with a variety of health concerns and needs, and going home to households where their household members have different concerns and different health needs. And so it's really important to me as an educator that I make sure that school is a safe place for kids to be. And in my opinion, one of the ways for that to happen is for I myself to be vaccinated. I'm also a parent. I have 2 children, and as of right now, older adolescents and adults are eligible to be vaccinated, and my children are not of that age, and so it was important to me to protect my own children in any way that I could, including being vaccinated myself. My parents, like Manny, my parents are a little bit older, and they also take care of my elderly grandmother, and I, similar to his story, I hadn't seen my parents who do live near, but I hadn't seen them really in about a year. And so it was very important to me that if I was vaccinated and they were vaccinated, that maybe then, slowly we could start to resume some of those gatherings, and that would be an important thing for our family. I had the Pfizer vaccine. I've had both doses now for about a month. After my first dose, I had some mild symptoms about 24 hours after the first dose. Some headache, body aches, just really fatigue more than anything. But I had gotten my vaccine on a Friday morning, and my symptoms came probably around lunchtime on Saturday. By the end of the day on Sunday, I felt just fine. So really the symptoms were really quite mild. I felt like I also got very good information from the agency in which I received my vaccine. The fact that I had some symptoms after the first dose, I had gotten some great suggestions from them about drinking some more water before the second dose, making sure I was well hydrated, well rested, things like that. And actually, when I got my second dose, I was lucky to not experience any side effects after that second dose. So again, I guess I would just reiterate that when you're making your decision about whether or not you want to get vaccinated, that it is important to have good factual information to base that decision on. Also, to remember that it's not about you yourself and whether or not you believe that you yourself would be someone who could survive COVID or who would be okay if they contracted COVID. It's about everyone around you. It's about the people you interact with at the grocery store. It's about the people you interact with at work or who your children interact with at school. It's really about keeping the community safe as a whole. Thank you.
All right, my name is Kayla Bear, and I live in Ettrick. So my story about choosing to get vaccinated is a little different than what Lindsay and Manny have shared. So my husband and I have been trying to get pregnant for a while, like 2 years. And so there was this concern that the vaccine caused infertility, and my mom sent me that article immediately. And I was like, okay, well, let me read through this. So I read through the entire article, and at the very end it says, there's no evidence to support that Pfizer or Moderna causes infertility. So I said, Mom, you got to read the whole article. And so that made me feel a lot better. I had a conversation with my healthcare provider as well and read information from the CDC that really these vaccines are not shown to cause infertility. So I decided to move forward with the vaccine, and I was not pregnant when I received my first dose. But I did get pregnant between the first and the second dose, and I was pregnant for the second dose. Still pregnant, not have a miscarriage or anything like that. So, so far the vaccine has protected me. So it's definitely been really giving me peace of mind that I am protected. Pregnant women are at higher risk of severe illness from COVID-19. So knowing that I have the vaccine helps me to feel a little more comfortable when I need to be at work or in the grocery store, that I am protected. It also helps to know that my baby is potentially getting some protection from COVID-19 as well, because I was pregnant when I received that second dose. So those are some things that, if you are thinking about having children in the future, or if you are currently pregnant or you're breastfeeding and you're unsure about whether or not to get the vaccine, I'd really encourage you to look at the CDC's website, because they have great information on that, specifically for those populations, and talk with your healthcare provider. It's a big decision to make for you and your family, and getting that correct information, as Lindsay and Manny have pointed out, is super important. I will also say that, with the vaccine being developed so quickly, I was a little worried, and Dr. Zellmer addressed that a bit earlier tonight. But prior to working in public health, I used to work in a lab, in a research and development lab. So I, was in the lab as a chemist, working firsthand with drug development, and knew it takes a long time for drugs to go through clinical trials and for them to make it out of the lab and into that development stage. But as Dr. Zellmer had said, we had a lot of financial support for a lot of different organizations and companies to be working on these vaccines, and that's something that normally doesn't occur in your day-to-day, medications or vaccines that companies are working on. So that helped me to feel more comfortable, because there was no financial constraint on these vaccines being developed, which was really important, and that's how they were able to move so quickly with these vaccine developments. And then another decision that another thing that helped me to decide whether or not to get it was thinking about the long-term side effects. So we don't know what the long-term side effects are of COVID-19 or the vaccine. But we're learning a lot more about the long-term side effects of COVID-19 and the short-term side effects, and they're not pretty. There's a lot of potential issues with lungs. And so, as a healthy young woman, I wanted to weigh my risk between the vaccine or getting the actual illness, and that illness, especially being higher risk as being pregnant, is something that I didn't want to risk. I would rather risk the vaccine and the low chance of a long-term side effect than this virus that we don't know enough about yet to know what kind of long-term effects it could have. So I got Moderna, and it was a great experience, as the other two have said. My first dose, I had no side effects at all. I felt completely fine. The second dose, I was kind of tired and had a headache. I could have been tired because I was pregnant. I don't know. But I just kind of took a little nap and relaxed that day, and I was totally fine the following day. So I have no regrets getting the vaccine. Like I said, I feel very safe being able to go to the store. And my husband works as a physician assistant intern, so I feel safe with him coming home and potentially being exposed, that he's not going to get me sick either. So talk to your healthcare provider, get your resources from the CDC, and if you have questions about getting the vaccine and you're not getting them answered elsewhere, you can message us on Facebook too with the Trempealeau County Health Department. We're here to help you guys. So now I'll let Dr. Zellmer just go through a couple of things he's been hearing in the community, some frequently asked questions.